Osama Mohammed, who will be talking about the role of combined MPFL, reconstruction, and lateral retinacular release for lateral patellar instability. Thank you.
Thank you so much. I'm Dr. Muhammad Osama. I'll be talking about role of combined MPFL reconstruction and lateral reticular release in lateral patellar instability cases. So this is the literature review. Basically, we all are aware of all this, that patellar instability is prevented by both the bony and the dynamic constraints. So I'll be talking about the dynamic constraints and how they are managed and what are the outcomes of that. So the aim of this study was to evaluate the efficacy of the aforementioned procedure, that is the medial patellofemoral recon and lateral release if required with it, in terms of both the radiological and the functional outcome. I also looked into the patient satisfaction rate that I'll come to at the end of the study. Okay, the study methodology was that it was done at the Gurki Trust Teaching Hospital, where I got trained, one of the institutes that I owe the most. The sample size was 47, and all the cases that underwent the aforementioned procedure after 2018 were considered. Among those that had complete record were included. Our mean follow-up in this study was 17.5 months, and the study duration, the duration in which we did all the data collection and the analysis, was 6 months. The first 6 months was 2024. Now, study methodology, we assessed the radiological outcome. As I mentioned, these are the three angles that we assessed: the congruence angle, the lateral patellofemoral angle, and the patellar tilt angle. We all are very well aware of the significance of these angles and correcting these angles so that the patella slides within the groove it's supposed to be. And the clinical outcome was done measured by the two most appreciated scores, the Techner-Lashon and the Kojala scores. Pre-op and post-op values were compared, and we looked into the satisfaction, patient satisfaction. As we all know, the word disease itself is a combination of dis and ease. The patient is not in ease, that's why he comes to our surgeons and to do something about it. So we looked into the subjective assessment by Neelitz score. This is the Kojala score, one of the renowned international scores, Lysom scores. Why we use two scores? There's inter-observer reliability of each and every score. So if you combine two, you're gonna get a better result. So coming to the crux of the study, the results, the Kojala score improved almost around doubled from 45 to 89. And look at the last value in the last column. It was highly significant with less than 0.001 p-values when the t-square testing, dependent t-square testing was done, dependent sample. Similarly, Lysom score got almost doubled as well from 43 to 87. And similar results with highly significant satisfactory results with p-value of less than 0.001. Coming to the radiological outcomes, the congruous angle that I mentioned before, it's the congruous between the patella and the trochlear notch. It got better, and its significant betterment was also noted with the p-value that's written over there. Lateral patellar tilt angle was increased, got better, decreased. Similarly, the patellar tilt got a bit more aligned towards the trochlear notch with a p-value of 0.04. Okay, coming to the subjective assessment, as I mentioned before, one of the most important things that we researchers most commonly leave behind while doing a research, that we don't go back to the patient and ask him how satisfied he was after getting through a surgery and then a rehab that took minimum of at least 4 to 6 months, and if he was a sportsman, he had to get back to his own activities. So this is one of the most important thing. We use the Neelitz score here to find out whether the patient himself was satisfied or not, or the only thing we were looking at were the radiological assessments and the scores that were invented by various researchers. So we went back there, checked that more than half of the patients, as is obvious by this pie chart, 51.1% was very satisfied with their outcomes. Similarly, the other large group was the satisfied patients, and then came the partially satisfied, and a minimal number of patients were not satisfied. So that means we are going in the right direction. Doesn't matter what clinical score says, the patient himself is happy, means we are making an impact at the individual level. So the conclusions, MPFL reconstruction, as I just mentioned, if needed combined with later research, is associated with significant improvement in the patellar stability, patellar tracking, and that has not only been suggested to improve with in terms of radiological and the functional scores that we assess, but also the patients are satisfied with it. So it's a double check, and then I say checkmate. We are doing the right thing. These are the references. This is a systematic review. Most of their findings were similar to ours, and this is another study done in 2020, one of the highly impact factor cited ratios, and it has also similar results. Thank you so much.